Hi, everybody. Going and signed in, so I'll give everybody until a few minutes after 1:30. But the chat should be live and the Q&A is open. So by all means, if you think of anything, pop it in there or let us know. Otherwise, we'll be starting shortly. Thanks. Just going to give a couple more minutes for anyone who's logging on a moment or two late before we get started. Hello, everybody. Welcome to the Xoran Veterinary Webinar, a tour of XoranConnect. We're largely going to be talking about some updates and new features, but I will be running through some of our sort of standard features that have been around for a little while as well. As I said, and it's in the chat, please feel free to drop any questions into the Q&A, into the chat box. Feel free. I hope this will be an interactive conversation where we get to talk through all this stuff, and you can feel free to let me know if you need more information about it, anything at all. So let's get started. Before we begin, know that this session is being recorded. Submit your questions via the Q&A button, as I said, and more information on any of our systems are, of course, available at XoranTech.com veterinary. A little bit about me. That is me. I'm Adrienne Wysock, the Xoran Veterinary Product Manager. I've been a certified veterinary technician, licensed in the state of Oregon for about 25 years. I maintain my certification here, even at Xoran. I have a master's degree in canine life science, and I work largely in specialty and emergency medicine for about 20 of my 25 years in practice. I've been a search and rescue volunteer since 2000. My husband and I train dogs to find people who are lost in the woods or in collapsed buildings after natural disasters. I am a self-proclaimed crazy cat lady, and although this dog in this photo is lovely, her name is Maggie, she is not my dog. She's just a cute dog from one of the practices where we actually have a device installed. The new release of XoranConnect is XoranConnect 6.1, and we are going to go on a little tour where we're going to highlight some updates and some of the new features. But as I said, we will be touching on a couple of the other features as well. Our outline for today, as decided by Business Cat here, is we will be talking about logging on and menu updates. We're going to take a look at how you review studies, the differences between the light viewer and the full viewer, how to share studies with clients, with other veterinary professionals, and a big introduction for those who haven't heard of it of our Xoran teleradiology option. So here's your login screen. This is kind of what you see anytime you hop on to XoranConnect. Please note the instructions on the right. If for some reason your XoranConnect is having a hard time, try these first. We noticed when we did update to 6.1 that there were a few issues, and this solved them right away. We will be talking about this section here, the patient access to scans, and we will also talk about the difference between the full viewer and the light viewer as well. But of course, the first thing to do is to log in. Here I am using Google Chrome. And just a quick question for everybody, which browser is your preferred browser? Just pop it into the chat. I usually use Google Chrome myself, but let me know if you use Firefox, do you use Microsoft Edge, do you use another product that I haven't heard of? I would love to hear your feedback. Oh, Firefox, interesting. I hear, as I said, I'm using Google Chrome. And depending upon how in-depth you want to get at viewing your studies, you will be able to do that with different amounts depending upon the browser you use, and I'll go into more depth about that. Dr. Barrett uses Chrome. Yep, that's what I'm using here. So just a couple of notes on the menu at the left. It's one of the big improvements we've made in 6.1 is the Streamlined Toolbar that you see here. So we have fewer menu items in general, and now we have a nested reports menu. So you can view your Xoran teleradiology reports. We'll talk more about that. You can do some statistics, you can search reports, you can view your backup status. That's what's there in the transfer status option. And now we have a veterinarian option when you're signing up for your XoranConnect account. So in Chrome, I'm using what's called the light viewer. If I want to view one of my patient studies, I just, click on that little plus next to the patient name that you see right here, and then on the study you want to open. Here, there's only one study for this patient, but if there was more than one, they would all show up on this list. To open the study, I'm going to click that name right there. So you can see this is very similar to how studies look in our Xoran software. In Google Chrome, I am using, as I said, the light viewer. We have many of the tools that you find in the software, but in the light viewer, you do not have all of the tools. For example, if you hover over that toolbox in the upper left-hand corner, you're going to see that we have options to show the overlay. So that's all the blue and green and orange lines, and show the ruler, which is also enabled. The ruler is, as you would expect, a ruler. You also have the option to restore original tilt and restore position and size. If you select those options, it'll sort of go back to exactly where the study was when it popped out of the scanner without any rotation or adjustment that you might have made in the meantime. I do that every once in a while when I get really deep into looking at a scan and I kind of want to go back to the beginning. I'll use the restore original tilt and restore position and size. As I said, that's also available in your regular software. Lastly, you can also apply a filter if you like. You can make the image look more smooth or more sharp. I would encourage you to explore using those options, both in the software and in XoranConnect when you're reviewing studies, just because it might give you a little bit of help if you're having a hard time looking at something. The Sun toolbar up there is your standard window and level, just like you have in your digital radiograph, just like you have in your software. You can do that same window and leveling here. And the last set of tools, I'll show you when we move on to the full viewer. Something else that's new with XoranConnect 6.1 is the ability to select images. Previously, this was only available in the Xoran software, but now you can select images in XoranConnect as well. This is more important as we discuss sending studies to clients or teleradiology or referral partners, but it's also pretty useful for communication kind of within your office. If you want to select an image in your device, that image selected will show up here as soon as that study is backed up. If you want to select an image in XoranConnect, you would obviously go to the image you want to select and click on the select section in the bottom right corner of any 3 of the MPR views. Those are here. Just in case you haven't heard that acronym before or you haven't heard it since our sign-in training, this view is what we call the MPR, the multiplanar reconstruction. And we call it that because it's a reconstruction in more than one plane, multiplanar. It's the field of view from 3 different planes. So once you click on one of those select boxes, You'll see that that box is highlighted. It now says selected, and there's a large thumbnail of that image in your viewing bar on the right. You can do this for as many images as you want. As far as I know, I've never hit a maximum myself. You can use that selected images option both within your practice and when sharing studies with others. So as we'll talk about later, we'll be able to select images to point out areas of interest if you send a study to teleradiology that might end up in your teleradiology report. You can also use this feature internally. So if, for example, you have your techs running a scan and they see something interesting right away, they can select an image. And then if you go to your laptop and you pull up XoranConnect and you look at that study, you're going to see that selected image here. That can also work vice versa. So if the doctor wants to point out something to the technician, you can select an image here, and then when that technician pulls up XoranConnect on their workstation, they'll be able to see those areas of interest. So you can see where I'm going here. You can do this between doctors and technicians, with front desk staff. You can also export selected images. We'll talk a little bit more about that later. And using the pin, you can show these to clients as well very easily and utilize the selected images so that they can see what you think is important. So this brings us to one of the differences in the full viewer and the light viewer, which is the additional tools available in the full viewer. So here I have the XoranConnect landing page where I've already logged in, and this is in Microsoft Edge. So the tools that we have in Google Chrome and the tools that we have in Microsoft Edge are a little bit different. On the Xoran landing page, I highlighted where you can set up the full viewer for Edge, and I did exactly that. I walked through those very simple and straightforward instructions. And now I have the full viewer landing right here. So it's the same patient, but you will notice that we have more tools than we had available in Google Chrome, and you can see those all right up there. Those are the same tools that are available in your Xoran software. So you could, for example, here in XoranConnect, add labels or notes or communicate between team members or point something out in a scan that you might be sharing with somebody else. Speaking of sharing a scan with somebody else, there's really a few different ways if you want to share a study with someone. You can do a standard sort of DICOM push from the device. You can set that. You can also set up to export selected images to an electronic medical record, or we would use a DICOM push if you send to, I don't know, Antech Radiology or something like that. If you want something set up on your device that you don't currently have, give a call to our customer service. Their number is in the bottom right-hand corner next to our web address. They can help you set up any export options that you might like. Another option is to create a PIN. That is one of the best options for sharing a study with a client. Or you could make someone a member of your practice. If you do that, that is a person who will be able to see and download all of your studies. And I would only use that for a professional that you know you're going to be working with regularly. So starting with creating a PIN. Creating a PIN, you would just click the PIN button to create a PIN, and you'll need to note the patient's birthday. You will get a pop-up as soon as you click that button. It's going to look like that. And you can then confirm the patient's information. You can set how long that PIN was going to work for, and the maximum for that is about 90 days. When you click Create here, you'll return to the study screen and you'll see a little pop-up at the top. If you click that blue word here, you'll be able to download the PDF, which looks like this once you open it. You can send that PDF to the client or whoever you want to share it with. Make sure you've noted the birthday, because as you remember from our login screen, they need to know that PIN number and that patient birthday, and this lets them know how long that PIN is going to be valid for. They can log in and view the study. This is what it looks like for someone who is viewing a study using a PIN. You can see that it's a very different interface, almost no tools available, but you can see selected images. Anyone who double clicks on one of those selected images, it will take the MPR view right to that selected image and will include any arrows or indicators or notes you might have made when you created that selected image. If you want to send a study to another veterinarian you can do that using a pin, just like I've described, but they won't be able to see the 3D like you can on your device, and they won't be able to download the study if they have another DICOM viewer. If it's someone you refer cases to pretty regularly, you might want to make them a member of your practice. Making somebody a member of your practice, as I've said, means they can see all of your studies and they can download them. So only do that for someone you are comfortable with having this level of access. So for example, you're a general practitioner and you work regularly with a surgeon and you do a lot of cone beam CTs and you refer those cases over to the surgeon to do surgery afterwards. That's someone who you might be comfortable with making a member of your practice so that they can glance at any of your studies and let you know what they might recommend and make sure they have whatever they're interested in the field of view. If you want to add someone as a member of your practice, you click on Practice Members in the profile menu right there. Here you can see the button to add a member to my practice. It's right there. As you can see, you can also remove people from your practice on the same screen by clicking that delete button right there. So it makes it easy to add somebody to a practice, and then if it turns out that they no longer work for that surgical practice, you can delete them so that they don't continue to have access to your scans. And one of the most exciting things I'm about to talk about is the last way we're going to talk about sharing scans with people, and that is our Xoran Teleradiology Team. Some of you have some experience with this already as we set you up in order to really get our system running. But if not, I'm going to walk you through what I think is one of the more exciting things that we're really talking about today. And as I said, that's our teleradiology. First thing to do, though, is to really introduce our teleradiology team. So the first member of our teleradiology team is Marco. He is a veterinarian from the University of Belgrade. He has his PhD in radiology and did a radiology residency from 2018 to 2020. He's currently the assistant professor in the Department of Radiology at the University of Belgrade in Serbia. Another member of our teleradiology team, who currently has my favorite photo of the team, I would say, is Anastasia. She is also a veterinarian from the University of Belgrade and is finishing up her PhD in radiology at the School of Veterinary Medicine at University of Belgrade. She's doing her PhD work in CT and conventional radiography on joint stifles of dogs, wolves, and jackals, which I think is really cool. And she is doing her residency right now. The last member of our veterinary teleradiology team is Alexa, also a veterinarian from the University of Belgrade, who completed a residency in small animal X-ray ultrasound and endoscopic diagnostics at the University of Belgrade. He did his residency thesis on CT and radiological diagnosis of lung diseases in dogs and cats. He is currently working in private practice. So these wonderful members of our teleradiology team are available 7 days a week. We aim to get reports back to you in about 48 hours. If you ever have a need to have something come back sooner, reach out to myself or to Dr. Sarmant, and we can help work with you and do some preliminary reviews, anything like that. But for the most part, you should be able to receive reports back in a couple of days, and I'm going to walk through some more of those details right now. So the first step to send a study to our teleradiology team is to complete a history. You will not be able to send something to teleradiology without completing a history. So you will need to click here to fill out the patient history information. You'll see a pop-up, and then you're going to want to click Add Patient History Record. Be as thorough as possible and include all the pertinent information. Please do not put images in here, as those are going to be difficult for our teleradiology team to see. We do request that you type things in when possible and don't send images of handwriting. I'm sure you have wonderful handwriting and your friends and staff are able to read it without a problem, but that doesn't mean everybody will. So in order to make sure that we're giving clear and concise information to our radiology team, please type things in here. To help you remember what to include in a history, or if you have your staff fill that out for you, one thing you can do is create your own template. You can do that by entering in what you'd like to be included in every patient history, as I've done here. So here I included patient name, age, patient gender and spay-neuter status, the breed, the reason why you performed the scan, history and any concurrent illnesses, any medications or current treatment, your diagnostic differentials, any other imaging performed and your impressions on that imaging, and any other comments that you have. With just that little bit of information in there, it's a great prompt to make sure that everybody is going to get what they need when you send this off for teleradiology. Once you put that information in, you can click right here to say Save as Template. That will give you a pop-up to name your template and give it a description. And then when you click OK, you will now have the option to select that patient history template anytime someone puts in a history. That makes it easy to make sure your staff is going to put in everything the teleradiologists need, and we aren't going to have any back and forth while we're trying to figure out what's going on with one of your patients. The next step to submit to teleradiology for review. And you do that by clicking here, and there will be a pop-up once you want to send it to review. This is that pop-up that will allow you to select teleradiology or add a new provider if you need to. If you don't already have Xoran Teleradiology available, you'll need to go to this screen where you can select a provider. Click search, and then you'll, oh, looks like I have an image over the top of my image. Excellent. Search there, and then you'll select Xoran Teleradiology from the list. You'll click that arrow and move it over to Xoran Teleradiology to the right, and then you're going to click Done. The study will now appear in your work list. You can see I have work list highlighted here in the upper left-hand corner, and you can view the report when it comes through in the same screen. When you send something to teleradiology, you'll automatically get an email letting you know that you have sent a study for teleradiological review. When that study comes back, you'll also receive another email letting you know that it's ready to be read. You would come back to this screen and then click the View Existing Case Report button, which is right there. You'll see a pop-up where you can select the report to view it. If there's more than one, for example, maybe you sent it back with questions or something like that, all the reports that are available will pop up. You click on the report you want to view. There's only one here, as I said, and that report's going to show up in this screen. You'll be able to export that as PDF if you'd like. You can review it. You can copy some of that text if you want to copy and paste that into your electronic medical record, or you might just want to export it as a PDF directly into your medical record itself. Please know that, as there is just here in my PowerPoint presentation, we're always working on improving what we offer, and there's always going to be an error here or there that isn't caught because nobody is perfect. I want to make sure that you feel like you can report those kind of issues to us. Here is our 800 number again. It's on the bottom of every one of these slides. It's all over our website. If you have an issue, a suggestion, if you want to call and tell them how amazing your veterinary product manager is, feel free. That's our job. We have people available 8 a.m. to 8 p.m. Pretty much every day of the week, and that is in Eastern time zone. You can also shoot me an email. I'm adrian.wysock@xorantech.com, and let me know if you have feedback, if you're having an issue. I'm here to help, and so is our customer service department. I would encourage you that if you're having an error or a concern with your device or your software, to call customer service. They can remote log into your machine. They can walk you through anything that you might need to do. If you have suggestions for improvement or workflow questions, then I'm definitely the person to ask. But when in doubt, customer service is always available for you. I want to make sure that we have time, because I know some of this teleradiology stuff might be new for some people, that you have time to ask questions. I can pull up the website and walk through some things if there's anything you want more explanation about. And so I'd really like to open this up now for questions or comments, suggestions for improvement, anything that you guys might have. You're welcome to use the Q&A. You're welcome to use the chat. But I am here to help. So please let me know how I can answer any questions or improve things for you. I did the similar webinar for our medical side earlier, and we had a couple of great questions, but one of them was whether we had our software had the ability to transcribe for someone who is a radiologist. And we don't have that capability, but I thought it was a really interesting capability because it would be nice to be able to just kind of like speak your patient history in. I'm going to give it about one more minute to see if anybody has any thoughts, questions, comments. If not, that's okay. We will have this information will be available. You can see my email address here to let me know if you need anything. Most of our veterinary customers probably have heard from me or have heard of me. So please feel free to let me know by email if there's anything you think of afterwards. I want to thank everybody for giving me a little bit of your time today. We set an hour aside just in case there were a lot of questions, but it seems like everybody feels pretty comfortable with the material I've covered. So again, I appreciate your time. Please let me know if you have questions, thoughts, comments, anything you think that we could be doing a better job of. I'd love to hear from you. In the meantime, thanks again and have a great rest of your week.